What actually happens to the prostate when a man masturbates every day is a question surrounded by fear, myths, and unnecessary shame. The prostate is a small gland, but it plays a big role in male urinary and sexual health, and understanding how daily ejaculation affects it can bring a lot of peace of mind. First, it's important to know that the prostate is designed to be active. Its main job is to produce fluid that nourishes and protects sperm. When ejaculation happens, whether through sex or masturbation, the prostate contracts and releases this fluid. This process is normal physiology, not a strain or an injury. For most healthy men, daily ejaculation does not damage the prostate, shrink it abnormally, or cause inflammation on its own. In fact, regular ejaculation may help prevent congestion in the prostate. Prostatic fluid can build up over time, especially in men who go long periods without ejaculation. This buildup may contribute to discomfort, pelvic pressure, or symptoms sometimes described as prostate congestion. Regular release helps keep secretions moving and may support better prostate comfort. Another common concern is prostate cancer risk. Large observational studies suggest that men who ejaculate more frequently over their lifetime may have a slightly lower risk of developing prostate cancer. While ejaculation alone is not a guarantee of protection, it does not increase cancer risk and may play a modest protective role by helping clear potentially harmful substances from the gland. However, daily masturbation is not automatically beneficial for everyone. If ejaculation becomes compulsive, interferes with sleep, work, relationships, or is driven by anxiety rather than desire, the issue is not the prostate, it's the behavior pattern. Stress hormones, poor sleep, and mental fatigue can indirectly worsen urinary and sexual symptoms even when the prostate itself is healthy. Age also matters. As men get older, the prostate naturally enlarges due to hormonal changes, not masturbation frequency. Daily ejaculation does not cause benign prostate enlargement and does not speed it up. Symptoms like weak urine flow, frequent nighttime urination, or urgency are usually related to prostate growth, bladder changes, or lifestyle factors, not ejaculation habits. The key takeaway is balance and context. Masturbation is a normal part of male sexuality. When done in moderation and without guilt or compulsion, it does not harm the prostate and may even support prostate comfort and awareness. Listening to your body, managing stress, staying active, and seeing a healthcare professional for new or worsening symptoms matter far more than counting how often ejaculation happens. Daily masturbation does not damage the prostate or cause inflammation in healthy men, and understanding this starts with knowing how the prostate is built to function. The prostate is a gland that plays an active role in the male reproductive system by producing fluid that supports and protects sperm. This fluid is meant to be released regularly through ejaculation. When ejaculation occurs, the prostate contracts naturally, empties its stored fluid, and then refills over time. This cycle is normal physiology, not a stressful event for the gland. A common fear is that frequent ejaculation overworks the prostate. In reality, the prostate does not become tired, worn out, or irritated simply because it is used often. Just like other glands in the body, it is designed to function repeatedly. In healthy men, daily ejaculation does not lead to swelling, injury, or chronic inflammation. Prostatitis, which is inflammation of the prostate, is usually linked to infection, pelvic muscle tension, nerve irritation, or immune responses, not masturbation frequency. Another misconception is that frequent ejaculation causes prostate pain or urinary problems. While some men may notice temporary sensitivity after ejaculation, this is usually related to pelvic muscle tension, dehydration, or anxiety rather than prostate damage. True prostate-related pain typically persists regardless of ejaculation and often comes with urinary symptoms such as burning, weak stream, or pelvic discomfort. These symptoms deserve medical evaluation, but they should not automatically be blamed on masturbation. It is also important to separate correlation from causation. Some men who already have prostate discomfort may notice symptoms after ejaculation, leading them to assume ejaculation is the cause. In many cases, ejaculation simply brings attention to an underlying issue that was already present, such as pelvic floor tightness or chronic prostatitis. Stopping ejaculation does not cure these conditions and may sometimes worsen congestion-related discomfort. Hormones also play a role in prostate health, and daily ejaculation does not disrupt hormonal balance in a harmful way. Testosterone levels fluctuate naturally throughout the day and are influenced far more by sleep, stress, weight, and physical activity than by masturbation habits. There is no evidence that frequent ejaculation lowers testosterone to levels that would harm the prostate or male health overall. For older men, reassurance is especially important. As men age, prostate size often increases due to hormonal changes, not sexual activity. Daily ejaculation does not accelerate prostate growth and does not increase the risk of benign prostate enlargement. Avoiding ejaculation out of fear does not protect the prostate and may contribute to unnecessary anxiety. Ultimately, the prostate responds best to normal use, good circulation, and reduced stress. Staying hydrated, remaining physically active, managing anxiety, and seeking medical care for persistent symptoms matter far more than how often ejaculation occurs. In a healthy body, daily masturbation is simply one of many normal ways the prostate carries out its intended function, without harm or long-term negative effects. Regular ejaculation may help reduce prostate congestion by preventing the buildup of prostatic fluid, and this concept is easier to understand when you look at how the prostate behaves over time. The prostate continuously produces fluid regardless of whether a man is sexually active. When ejaculation does not occur for long periods, that fluid can sit in the gland and surrounding ducts. For some men, especially those prone to pelvic tension or inflammation, this stagnation can contribute to a sensation of fullness, pressure, or discomfort in the pelvic area. Prostate congestion is not a disease, but rather a functional state where secretions are not being released regularly. This can sometimes mimic symptoms of prostatitis, including dull aching in the pelvis, heaviness between the legs, or discomfort after long periods of sitting. Regular ejaculation allows the prostate to empty, helping fresh fluid replace older secretions. This natural flushing process may support comfort and normal gland function. It is important to clarify that ejaculation is not a cure for prostate conditions, nor is it a medical treatment. However, in otherwise healthy men, it can be a supportive habit that promotes circulation and glandular movement. When the prostate contracts during ejaculation, blood flow increases temporarily, delivering oxygen and nutrients while removing metabolic waste. Healthy circulation is a cornerstone of tissue health throughout the body, including the prostate. Some men notice that prolonged abstinence leads to nocturnal emissions, pelvic discomfort, or increased sensitivity. This is the body's natural way of managing fluid buildup. Regular ejaculation, whether through partnered sex or masturbation, provides a predictable and controlled release which may reduce these uncomfortable sensations. This does not mean a man must ejaculate every day to be healthy, but it highlights that regular release is physiologically normal. There is also a psychological component to congestion. Anxiety, shame, or fear around ejaculation can increase pelvic muscle tension. Tight pelvic floor muscles can compress nerves and blood vessels around the prostate, worsening sensations of pressure or pain. When ejaculation is approached calmly and without guilt, the pelvic muscles are more likely to relax, supporting smoother prostate contractions and better overall comfort. Hydration and movement play an important supporting role. Thickened prostatic fluid can be more difficult to release, especially in dehydrated men. Drinking enough water helps keep secretions thinner and easier to expel. Physical activity improves blood flow and lymphatic drainage in the pelvis, further supporting prostate health alongside regular ejaculation. For men experiencing chronic pelvic pain or prostatitis-like symptoms, ejaculation frequency should be individualized. Some men feel relief with regular ejaculation, while others may need temporary moderation during symptom flares. The key is listening to the body rather than following rigid rules. Persistent pain, urinary changes, or sexual discomfort should always be evaluated by a healthcare professional. In summary, regular ejaculation may help reduce prostate congestion by keeping secretions moving, supporting circulation, and preventing prolonged stagnation. It is a natural process that works best when combined with hydration, physical activity, and stress management rather than fear or avoidance. Frequent ejaculation has not been shown to increase prostate cancer risk, and understanding this can help reduce a great deal of unnecessary fear. For decades, men were warned, often without scientific backing, that too much sexual activity could somehow irritate the prostate or trigger disease. Modern research does not support this idea. Instead, large population studies observing men over many years suggest that higher lifetime ejaculation frequency is associated with a slightly lower risk of developing prostate cancer. One possible explanation involves the concept of biological clearing. The prostate is exposed to hormones, inflammatory byproducts, and environmental compounds that enter the bloodstream. When prostatic fluid is released regularly, these substances may be flushed out more efficiently, reducing prolonged exposure within the gland. While this theory does not prove cause and effect, it offers a plausible biological mechanism for the observed association between regular ejaculation and reduced cancer risk. It is essential to emphasize that ejaculation is not a guarantee of protection. Prostate cancer is influenced by many factors, including age, genetics, family history, hormonal balance, inflammation, diet, obesity, and overall metabolic health. No single habit can override these influences. However, the absence of harm and the possibility of modest benefit means there is no medical reason to discourage healthy sexual activity based on cancer fear alone. Another important point is that prostate cancer develops silently over many years. It is not triggered by short-term behaviors or sudden changes in sexual frequency. Men sometimes worry that increasing ejaculation will activate cancer cells or make existing cancer grow faster. There is no evidence that masturbation or ejaculation accelerates prostate cancer progression. Cancer growth is driven by cellular mutations and hormonal signaling, not by how often the prostate contracts during ejaculation. Screening and awareness remain far more important than ejaculation habits. Monitoring prostate-specific antigen levels when appropriate, understanding family risk, and discussing urinary or sexual changes with a healthcare professional are the most effective ways to protect prostate health. Focusing solely on ejaculation frequency can distract from these proven preventive strategies. Mental stress also deserves attention. Fear-based beliefs about masturbation and cancer can increase anxiety, elevate stress hormones, and negatively affect sleep and immune function. Chronic stress is linked to systemic inflammation, which may contribute to many chronic diseases. Removing guilt and misinformation around ejaculation can therefore have indirect benefits for overall health, including prostate well-being. Lifestyle factors amplify risk far more than sexual frequency. Diets high in processed foods, sedentary behavior, smoking, excessive alcohol intake, and poor sleep have all been associated with worse prostate outcomes. In contrast, regular physical activity, maintaining a healthy weight, consuming fruits and vegetables, and managing blood sugar support long-term prostate health. Ejaculation frequency sits far lower on the list of meaningful risk factors. In practical terms, men should view ejaculation as a normal bodily function rather than a medical threat. Whether ejaculation happens daily, weekly, or less often should be based on comfort, desire, and quality of life, not fear of cancer. The evidence is reassuring. Frequent ejaculation does not increase prostate cancer risk and may be one small piece of a broader, healthy lifestyle that supports prostate health over time. Prostate enlargement with age is driven primarily by hormonal changes, not by how often a man ejaculates, and this distinction is crucial for understanding urinary symptoms that develop later in life. As men get older, shifts in testosterone and its conversion to other hormones cause prostate tissue to gradually grow. This process is called benign prostatic hyperplasia, and it affects a large percentage of men over the age of 50. Masturbation frequency does not initiate this growth and does not accelerate it. Many men notice urinary changes and assume they are related to sexual habits. Symptoms such as a weaker urine stream, difficulty starting urination, frequent nighttime trips to the bathroom, or a feeling of incomplete bladder emptying often appear around the same time sexual patterns change with age. This timing can create confusion, but the underlying cause is prostate tissue pressing on the urethra as part of a natural aging process, not ejaculation behavior. Ejaculation does cause temporary prostate contraction, but this does not influence long-term size. The prostate relaxes shortly after ejaculation and returns to its baseline state. There is no evidence that frequent contraction causes muscle thickening, scarring, permanent swelling. In fact, men with benign prostate enlargement often report that ejaculation temporarily improves urinary flow due to relaxation of surrounding muscles, although this effect is short-lived. Avoiding ejaculation does not prevent prostate growth. Some men reduce sexual activity in hopes of resting the prostate. The gland continues to respond to hormonal signals regardless of use. Prostate cells grow in response to internal biochemical messages, not to mechanical activity. As a result, abstinence does not shrink the prostate or slow enlargement. What does influence prostate enlargement and symptoms are metabolic and lifestyle factors. Obesity, insulin resistance, chronic inflammation, and physical inactivity are strongly linked to worse urinary symptoms. Excess abdominal fat alters hormone balance and increases inflammatory signals that can worsen prostate growth. Regular exercise, weight management, and a balanced diet have a far greater impact on urinary comfort than ejaculation frequency. Fluid intake patterns also matter. Drinking large amounts of fluid late at night, consuming caffeine or alcohol, and poor bladder habits can intensify nighttime urination and urgency. These factors are often mistakenly blamed on the prostate itself when they are actually modifiable behaviors. When symptoms become bothersome, medical evaluation is essential. Medications, pelvic floor therapy, and in some cases minimally invasive procedures can dramatically improve quality of life. These treatments target prostate tissue, bladder function, and muscle coordination, not sexual behavior. Men should not delay care because of embarrassment or the belief that masturbation habits cause their symptoms. The key message is reassurance. Prostate enlargement is a common age-related condition driven by hormones and overall health, not by how often a man ejaculates. Sexual activity, including masturbation, can remain a normal part of life without worsening prostate size or urinary outcomes. Understanding this allows men to focus on evidence-based strategies that truly protect comfort and long-term prostate health. Mental health, stress levels, sleep quality, and lifestyle habits have a far greater impact on prostate and urinary symptoms than how often a man masturbates, and this perspective is often overlooked. The prostate does not function in isolation. It is deeply influenced by the nervous system, hormonal balance, immune responses, and blood flow, all of which are shaped by daily habits and emotional health. Chronic stress plays a major role in prostate discomfort. When the body is under constant stress, stress hormones remain elevated, causing muscles throughout the body to stay tense. This includes the pelvic floor muscles that surround and support the prostate. Tight pelvic muscles can compress nerves and blood vessels, leading to pain, urinary urgency, weak flow, or burning sensations that are often mistaken for prostate disease. In these cases, the prostate itself may be structurally normal, but the surrounding tension creates symptoms. Sleep deprivation further worsens this cycle.
If you're hearing these last words, know this: you don't consume content, you extract value. While others chase distraction, you choose growth. That choice will always separate you. If today's video sharpened your thinking or strengthened your resolve, hit subscribe and tap the bell. What's coming next is built to raise standards, not noise. Until then, stay intentional, stay disciplined, keep rising.